viewers, you are welcome to today's Earth Talk, Earth Information on our favorite TV, Ignite TV. This is the program where we discuss our daily health issues and activities that promote our health and identify those ones that cause issues or future complications. Today, we'll be discussing the topic diabetes. What is diabetes? It's a chronic metabolic disease characterized by elevated level of blood glucose. Metabolic disease or disorder. To a lay person, they will say they have sugar in their blood, sugar in the urine, or sugar disease. Some might probably think it is as a result of excessive intake of sugar or carbohydrate. But I want to bring it to our view this morning that it is not necessarily an excessive intake of sugar or excessive intake of carbohydrate. What happens in diabetes? In most cases, our body is supposed to produce an hormone called insulin. Insulin is produced by the pancreas of our body, and insulin is responsible for regulation of the level of glucose in the blood. 2 or 3 things might occur. Number 1, situation might occur whereby an individual have problem in the production of insulin. If anything affects the pancreas and the body is not producing sufficient insulin, definitely there will be accumulation of glucose in the body, because it is this same insulin that controls the level of glucose within the blood. Number 2, if the body cells are not really uptaking the glucose that is accumulated within the blood circulation, there will be accumulation too. Because in a normal situation, there should be movement of this glucose in the blood into the body cells. The body cells utilize it, and the remaining there will be maintaining the level of the glucose. But if the body cells are not taking it, then there will be accumulation. There are types of diabetes. We have type 1, we have type 2, we have gestational diabetes. The type 1 is as a result of when the immune disorder of the body affects or destroys the pancreas. That is, there won't be production of insulin, and there will be accumulation of blood glucose. And then number 2, we have a lot of things that occur there. It might be genetic. We have cases whereby the mother, the daughter, the grandchildren, and such like that. It is hereditary. The type 2 is hereditary. Some, their type 2 is acquired as a result of the accidental life pattern. Some as a result of excessive weight gain or obesity. The number 3 type we will be discussing today is the gestational diabetes. Gestational diabetes occur during pregnancy, and this occur when the hormones of the body that is released affect the body hormone. When this occur during pregnancy, it also increase the level of sugar. What are the signs and symptoms? What are the things we see that signify that there is diabetes mellitus? There is frequency in nutrition. For example, the frequency and the quantity of the urine will be so much that an individual might even be during the day or during the night visiting to methylate like 6-7 times before the day break, and we seeing people losing a lot of water during the day or during the night. There will be testing. Anybody that is losing a lot of water will definitely have testing. So there will be increase in the intake of water as much as the person is going to urinate. The person, there may be dryness of the tongue or the mouth. At the same time, the person will be having a voracious appetite. There will be increase in the intake of food. The food you are taking, the body cells are not utilizing it, it's just accumulating within the blood circulation. Definitely, there will be demand by the body cells. So the person will be eating voraciously, there will be increase in the food intake. At the same time, the body is not using it. So that person might be losing weight. There will be emaciation. The person will be losing weight. As much as the person is eating, it will not be showing in the body. It affects the skin. The skin becomes dry. In some cases, there is white patches or black patches all over the skin. There is tingling sensation. Some of them have lots of sensation in the foot or in the hand. Some will have numbness. Some will have a feeling as if blood is not flowing to those parts of the body. Some of them doesn't even have feelings, and that is why we always encourage them not to walk with their leg, because sometimes they match things and they don't know, and it might cause problem. There is dryness of the skin. There is low erection in men. There is low erection in men. Initially, it might not be total dysfunction of erection, but later it may get to that level. Their healing is very slow. The healing is very slow. Whenever there is little or small cut of wound, it takes a long time before healing can take place. These are the common signs that will be presented by a diabetic person. When this occurs, what and what are we expected to do? What and what are we expected to do? Once it occurs and you see from this sign and symptoms that what they are discussing on Ignite TV today, it seems I have 1 or 2 or 3 of these, my advice would be report to the health practitioner. Go to the nearest registered hospital whereby investigation can be done. At the same time, management and effective treatment can be given. On this view, we want to manage each and every condition of type. Type 1, under the management, the type 1, like I rightly said, affects the production of insulin. The pancreas is involved, is affected. So the patient or the person will be living on insulin. Insulin that will be given will be substituting for the normal body insulin that the body supposed to have produced to maintain the body glucose. So the person, the individual can survive on insulin. On the type 2, depending on the cause, if it's as a result of sedentary life, excessive weight or obesity, we always advise on moderate life pattern, avoidance of sedentary, involving on exercise. Exercise will always help in this type of case. And the drugs prescribed within the hospital will always help to manage the case. But there are three fundamental things which should be followed in all cases. In the gestational one, it is obvious that once the patient delivers, the problem might stop. In some cases, that ends the problem. In some cases, they become a type 2 diabetes mellitus patient, in which they will need to still maintain their blood glucose with medication, with exercise, and with moderate and diet monitoring. Under the diet monitoring, it affects every other aspect of the diabetes, including the type 1, the type 2, and the type 3. If you are on insulin, you still need to control the rate at which you take your glucose. These days, we involve in moderation of carbohydrate intake, putting a lot of vegetable and fruits and protein to maintain life. We need the carbohydrates, but it's going to be at a moderate level to maintain the body energy and with every other food intake at a moderate level. And that is the essence, that we have to be under a particular health practitioner that monitor every aspect of this. Regular fasting blood sugar, regular random blood sugar, to ensure that the drugs are really doing those expected things, to ensure that an individual is really following the instruction given dietically. Take this, don't take this. The carbohydrate intake moderation, putting an example of a diabetic patient that wants to take a breakfast, can take a normal pound of wheat with memory. In the afternoon, the patient can take a moderate size of efo with lot of vegetable, a moderate size of rice with beans or moimoi or vegetable. The person can take a moderate size of every carbohydrate with lot of protein and vegetable to maintain diet. There is no excess intake of glucose. In all this, whatever you are taking in form of drugs should be maintained regularly and should be checked at regular interval by your medical practitioner. It is not the type of medication you can just be buying and be using and be taking. At the end of the day, we have cases of sudden low glucose or sudden high glucose. So definitely the person should be under monitoring of a medical practitioner. I want to add that all this we are doing, as much as we are taking the drug, we are maintaining the diet, and we are doing everything, we want to ensure that the signs and symptoms are not getting worse. As much as you take your drugs, you have to be observant. You are taking your drug, you are taking your food, you are doing your exercise. You have to ensure that the symptoms are not getting worse. You are not continually losing weight. You are not still waking up during the night to go and menstruate like 4, 5, 6 times before the day break. You have to ensure that the signs and symptoms are reducing at a gradual rate. This is a self-assessment that will make you to know that you are really doing well. In the hospital, we do train. What are our trainings? Our training includes: number 1, how do you check your blood glucose without coming to the hospital? Peradventure, if you have a feeling of excessive sweating, Sometimes when there is sudden low glucose, there will be excessive sweating. You will be sweating as if, and you will be feeling a sign of weakness. You need to check your glucose immediately. Once it is checked, you will be able to ascertain, oh, it is my glucose that is low. Oh, it is my glucose that is high. Peradventure, if it is low, then you need to take immediate a glucose solution or food that will be able to help to balance the level of the glucose, so that you won't have a case of hypoglycemia. As part of it, as much as you are doing self-assessment, you will train how to see the signs of sudden rise or sudden low of glucose. So when you are in your respective home, you must be giving yourself a self-assessment according to the training. If the condition is getting worse, we should not say because we are on treatment we don't need to go back to the hospital. If you are taking your drug, you are taking everything, and the glucose and the rate and the condition and the signs and symptoms are not reducing, the best thing is to go back to the hospital. There may be need for further investigation or increasing the level of medication given. So that is why we need to do a self-assessment. On the program, we will come back in few minutes to continue. Please stay tuned.
TV, igniting the good news on your screen.
To our series of Health Talk. Don't forget, our topic for today is diabetes mellitus. We want to discuss what are the complications that may come up if a case of diabetes mellitus is not properly managed or recognized in time for appropriate management. We have a lot of complications. In fact, diabetes affects virtually all the systems of the body. Let us take from the skin. We have neuropathy. Neuropathy affects the nerves. Like I said the other time, there may be loss of sensation, there may be numbness, there may be funny sensation of the body. In the case of loss of sensation, you see people marching on stones, marching on this, marching on that, even without knowing they are marching on something. And if this occurs, there may be what the condition we call diabetes foot. Diabetes foot occur, there may be wound. The wound might not necessarily heal up. And that is why in some cases, it might lead to amputation of the leg as a result of diabetes foot. As part of the complication, we have the one that affects the vessels of the body. If the blood vessels are affected, it can cause a case of stroke. Diabetes mellitus is not what we can just overlook. It affects our individual eyes, causing retinopathy. When this occurs, it affects the eye of an individual. Initially, there may be blindness, inability to see well. Later, it might develop into some serious cases of retinopathy, which might definitely lead to blindness. Apart from that, we have affecting the kidney. When it affects the kidney, it also causes nephropathy. Diabetes mellitus affects the skin. In these cases, there may be itching, there may be irritation, inability to sleep, and what have you in most cases. All these are complications. But prevention, I want to say, is better than cure. So I want to emphasize more on prevention of diabetes mellitus, or better prevention of complications that may come up as a result of diabetes mellitus. Now, number one prevention is identification. How do we identify? Lis ten to this program and an individual is able to identify that one or two or three of these signs and symptoms are present. That is self-assessment. And the next thing I expected anybody to do is to go in time to an health facility, whereby this condition could be investigated, diagnosed, and managed properly. Number two, lis ten and following instruction of management. In some cases, people identify problem, they suspect problem, they go to the hospital, but they did not follow up. Once they are taking their drugs, they may ignore the rules and regulations of medication. And like I said at the early part of this program, that there are three cardinal things we have to follow. Number one thing is identification of that condition. We take our drug regularly, we follow our dietary instruction regularly. Number three, we involve in exercise and make sure regular investigation are done. A routine fasting blood sugar should be done at most twice to three times by the client or an individual in their respective home once you are a confirmed diabetic patient, to see whether you are doing well, you are progressing, or you are not doing well. And as soon as you see that the sugar is not really coming down and is going up, the best thing is to go back to the hospital so that there may be need for further investigation or increasing the level of drugs. As part of the advice, taking a traditional medicine simultaneously with the medical drugs. There may be drug interaction. One might be preventing the other to work, or one may be destroying the medicinal composition of the other. So it is a medical condition which can be treated or effectively managed by drugs, by diet, and exercise. As part of the preventive step, to every family that will have father or mother having diabetes mellitus, the children in the family should not be waiting until 60, 70 years before going for routine yearly medical examination, through which a blood test will be done, and this might be gotten before it gets to the level of causing any complication. So the gestational diabetes, to every of our mother that are pregnant, we advise that we should manage the antenatal clinic in a respective registered premises where they will be adequately managed, the gestational diabetes diagnosed, so so that it will not cause problem for both the mother and the unborn child, and there will be proper medical management. Generally, we should not wait until we are called a diabetic patient before we have a moderate life pattern. A sedentary life pattern is also one of the causes that expose some people to diabetes. As part of our prevention, we should try as much as possible to take care of ourselves. We should take care of ourselves. In this fashion, I want to say that anybody that is diabetic should be excessively hygienic. They are prone to certain infection because the immune system is also affected. So they should ensure that the environmental and the personal hygiene is actually properly managed to prevent unnecessary and undue infection from occurring. Generally, diabetes mellitus is a case to discuss because of its occurrence on the higher rampant these days, even among the youth. So we should endeavour within the church of God, within our community, to go for self-assessment of fasting blood sugar, random blood sugar. If it cannot be in the morning, it can be random, that is after you might have eaten 2 hours later, so that we discover the problem in time before the problem cause complication unnecessarily. We want to encourage us that we should continue to stay tuned on this edition of Health Talk, where we discuss issues that pertain to our health, that resolve our problems, that solve our questions that we cannot ask anybody. See you next week on the same edition of Health Talk. Thank you for listening.